So what actually happens in the IVF lab? If you want to find out what happens in the sanctum sanctorum of the IVF clinic, what happens in the heart of the clinic, which is the lab, please watch this video right till the end and I'll be happy to share this information with you. I'm Dr. Malpani. I'm an IVF specialist. I run Malpani Infertility Clinic and I've been doing this for 30 years. And there's lots of information on our website, so you want to watch videos or you want to see actual procedures being done, please check out our website. Now, when you go to an IVF clinic, you fill in a form, the nurse takes an interview, the assistant does, you meet the senior doctor, writes out a treatment plan, all that good stuff. You then do ultrasounds, the doctor checks your ovaries, maybe does blood tests, checks your E2 levels, and then the doctor does the egg collection. And then this is where the black box really is, because what happens in an IVF lab is very mysterious. It's behind closed doors. IVF lab, no entry, really no one's allowed within the IVF lab because what we're doing is so important. We're actually culturing, taking care of your eggs and sperm so that they become embryos, and we nurture these embryos. Think of them like the culture medium is actually like chicken soup for the soul, in this case not the soul, for your embryos, and we're helping them to grow. And that's why an embryologist is so important, and that's why a full-time embryologist, someone who's experienced, someone who's expert, someone like Dr. Sai Prasad, our embryologist who's been with us now for over a decade, and he's full-time, is so important because he knows exactly how to handle your eggs and grow them into embryos and pamper them and grow them into blastocysts and freeze them. And a lot of what happens in the IVF lab is not obvious to patients. Actually, it's not very obvious to IVF doctors also, because most gynecologists don't have a clue. They've never even been inside an IVF clinic. But a lot of IVF doctors themselves have never been in an IVF lab because they do the ultrasound pickups, they talk to the patients, they do the egg collection, and then what happens in the IVF lab is up to the embryologist. That's his job. What do they understand? And this can be a bit of a problem. Now, you don't need to be an embryologist, but you do need to understand what he's doing and why he's doing it. And that's the reason why you need to ask questions. Now, remember one thing. The most important thing the IVF lab does is make embryos. That's simple enough. That's why every good IVF lab always gives photos of the embryos proactively and routinely to all their patients. You may say, why? How does it matter? Because that's documentation. A good IVF lab and a good embryologist is proud of the embryos they make, and they're proud to share the quality of the embryos they've made with the patients and with other IVF clinics, because of course patients will doctor shop, get a second opinion, and if they can prove that they've produced a top quality blastocyst, then any other doctor providing a second opinion will say, yes, this IVF clinic provided you with good care. They grew good eggs for you, which made good quality embryos. Did implant, that's a black box which you can't control, but at least your quality of medical care was great, which is very reassuring for patients to hear. But if the doctor refuses to allow you to talk to the embryologist, if the embryologist refuses to talk to you, if they refuse to share embryo photos, then what do you have? You're forced to depend on what the embryologist chooses to say, and unfortunately, lots of them don't say the truth. They say all kinds of things. Oh, you have a top quality embryo, these are great. But what does great mean? Are they really great, or are you just saying that to pacify me? And if they're really great, why aren't you giving me photos of my embryos? And again, they make all kinds of excuses. Oh, our camera is not working, it's dangerous, the light is bad for the embryo. All rubbish. And anyone who refuses to give you embryo photos is hiding stuff. Something's slimy and something's wrong, and you need to worry. And even if they're poor quality embryos, a good IVF lab will always give you photos to document that, okay, this is what your embryos were and this is what the problem was. Why would they want to hide something from you? And after all, not everything is in the IVF doctor's hands or the IVF lab's hands, but they need to be open and transparent with you. And if you want them to be open and transparent, you need to earn that right to ask questions. And the only way to earn that right is by doing your homework, so that if you ask intelligent questions, they'll be forced to provide intelligent answers and not take you for a ride. Have questions, get confused, first go to our website, tons of information there, and you still have more questions about your specific problem, feel free to send me an email. There's a free second opinion form on our website on www.drmalpani.com. That's drmalpani.com. This comes to me personally, it's confidential. I answer all these forms. I'll reply within 24 hours and tell you what's right for you. Look forward to seeing you digitally and look forward to helping you to have a baby. And remember, if you know what's happening in the IVF lab, your chance of having a baby will be much better.